Hi, everyone. Welcome to the September 2023 Ask the Expert interview series. Today, I have Todd Lamkin with me from Care Patrol. So welcome,
Morning,
Todd.
Jennifer. Good morning.
And some of you may recognize that last name. Todd is the husband of our executive director, Lindy Lamkin. And together they have a business called Care Patrol. And September is Healthy Aging Month. So we talk a lot about best ways to try to, continue to age healthy throughout your life. But once we get up in age, a lot of people are not as lucky as we all hope to be and are not able to live alone and independently. And this is something that Todd is able to help with, come in and talk to families about options for individuals who are aging. And so I'll just ask Todd if you can just tell us how you got involved with Care Patrol and then just tell us more about what the organization does.
Yeah, no, and thanks for having us on here, Jennifer. As we age, it's very important that everyone remains as independent as possible. Really, for the simple fact that that's what everyone wants. They don't want anyone else to help them. And so it really started for me. It started years ago. I had witnessed my grandfather who had Parkinson's, and he really struggled, closer to the end, in terms of remaining independent in his home. And we found him one night at the neighbor's house, and it was about 1 a.m, and he lived a little bit out in the country. And so it wasn't just a, walk 50 feet to the neighbor's house and go inside. It was a little bit farther than that. And they ended up calling EMS. They came out, they picked him up, took him to the hospital. And, they called us in the middle of the night and said, "Hey, we've got him over here at the hospital. He's doing fine, but we just want to let you know." So obviously we get up, go to the hospital. And the next morning, the doctor comes in and he says, "Well, we're going to discharge him." And we're going, "Wait, what?" He ended up at the neighbor's house. Like, how is this normal? And he said, "Well, hey, medically, he is fine. So we're going to discharge him home. He has no reason to stay in the hospital." And so we went back home. A couple family members stayed with him for the next couple days. And we ended up transitioning him to an assisted living community where they could assist with activities of daily living. And it was really that situation with our, my own family, that when I saw Care Patrol, I was like, that's it. We can help people in a crisis situation, but also more on like that estate planning side of things, where what happens if we can't remain independent anymore? What happens if we need assistance with bathing? Or we have frequent hospital visits? Like, these are all things of, hey, someone just needs a little bit of assistance, but they still want to be able to, maybe they still want to be able to drive. We have a lot of folks that go into assisted livings who are still actively driving, some, kind of a question mark on there, but, they're still independent, very independent. And so when we found Care Patrol, it really struck home for us in that we could serve people in our community, with a service that is free to the community. So it's free to any families that we work with. And we really walk them through the process of, hey, what do we actually need here? What financially can we afford? And then where do we want to be? And walking them through our care discovery process puts a lot of clarity for families, in terms of what is best for mom and dad, or aunt and uncle, or brother or sister, and that's really what we're set out to do, is to help folks in our community remain independent and get the support that they actually need.
Awesome. So what, you're saying community and area, so what portion of Kentucky, Anna, do you all cover?
So we cover Greater Louisville. Basically, we go out to LaGrange, not quite to Shelbyville, down to Mount Washington, and then we actually work in parts of southern Indiana as well. So from Corydon up to Sellersburg, down to Jeff. And Care Patrol, we are actually part of a franchise group. So there's about 150, 160 right now, owners like myself across the country who, we can refer other family members to. So, for example, there is a couple that runs Care Patrol down in E-Town, all the way over to Lexington, and they basically are covering Central Kentucky. There's a location in Cincinnati, Dayton, Indianapolis, pretty much anywhere in the United States, honestly. We can find a Care Patrol that's a resource that can help families. And really what we find a lot of times is that kids may not live at home anymore. They may have moved away for work, maybe they got married, whatever the case may be. But a lot of children do not live at home where they grew up or in that general area. And we can work with those kids to help transition mom or dad somewhere else. For example, I'm working right now with a family that one son lives in Atlanta, the other son lives in Rochester, New York. Mom and dad live here. And they said, hey, we want them to go to one place or the other. We don't care, but we don't want to leave them in Louisville because we always have to come back here. And so we just simply made a referral to Atlanta and to New York, and the Care Patrol locations there are able to help them with options and pricing and all of that, that we would normally do here for them.
So how do families who are, beginning to think, grandma or grandpa or mom and dad are, starting to show some signs where they might not be as safe as they used to be in their home, how do these families connect to you?
It really starts with a phone call. That's the best way for us to connect with someone. We can quickly identify, hey, what's going on here? What's a high level situation? We do work a lot with case managers, social workers, because the placement side of things, when you look at moving someone, case managers and social workers often aren't up to date with what's going on with communities. And assisted living communities, there's a lot of change that happens very frequently with them, a lot of times, from staff to management changes to ownership changes. There's things that take place that we're aware of that a lot of other people are not, because they're not in that space every day. And so it really just starts with a phone call from the family, just to connect with us, to say, hey, here's what the situation is. Here's kind of what we want to accomplish or what we're trying to do, but what do you think? And back to the original point is everyone wants to age and they want to stay independent and stay in their home. But the reality is that doesn't always work. And simply for the safety of that individual. And so that's where that phone call helps to just give us an understanding of what is it you're trying to accomplish? What are your goals here? And from there, we can identify any chronic acute illnesses and really what is holding someone back from staying at home. And obviously with the Kentucky Lions Eye Foundation being devoted to vision, vision is one area that a lot of seniors, if they do have issues with their vision, they feel less independent. And we've worked with a lot of folks who were visually impaired, and getting them to a community where they didn't need total assistance. They just needed someone to kind of help and, hey, lay my clothes out, I can put them on myself. Or, hey, can you come walk me down to the dining room? Until I can figure that out, help me with that. And that's really what it's doing. I mean, we're just trying to keep their independence as much as possible. Um, but it starts with that initial phone call.
And you just mentioned, vision being one of the reasons why family members might be reaching out. A family member might be starting to lose vision or be what we consider low vision. But what are some other kind of common reasons why families are reaching out? What are issues that they are seeing with their mom or dad or grandma, grandpa, that are causing them to want to reach out?
Right. A lot of issues that we see are around medication management. Um, as we age, it's just something that happens. A lot of folks end up on quite a few medications. It may be 8, 10, 12, 15, 20. I mean, I've seen like 30, someone on 30 medications. And being young, it's difficult enough to manage that. But as we age, it becomes an even more difficult task. And so med management is one of the areas that we see um, issues for seniors. The other one is, frequent falls. Um, we'll see certain chronic conditions that are maybe causing some dementia-like symptoms that can be a reason that someone doesn't feel safe in their home anymore, or the family members don't think that they're safe anymore. Um, and it's really once we identify those, like that's the time for us to start talking. And even we could talk even before that, but that's kind of a trigger event that says, hey, we're concerned here. But those are some of the main ones: the medication management, falls, changes in mood, food. Those are all areas that we see patients who the family members have expressed concern. Hey, we don't think they should be going home, or we don't think they should remain in their home.
And so, how do you determine what the best facility is? Do you all go out and do site visits to facilities and kind of get to know the facilities? Is that how you're kind of building those resources?
We do. So we do, and I alluded to this earlier, but we do a care discovery process with every family. And so really what we're looking at three things. We're looking at the financial means, we're looking at the clinical situation, so any chronic acute illnesses. And then we're looking at, hey, what location or what part of town are you interested in? Maybe where do the kids live? Where do the grandkids live? So we're looking at those three things primarily to identify what facilities would be options for that individual. And again, the clinical side of things drives a lot of that. And once we identify, 3, maybe 5 communities that would meet the needs of that individual, we're sending those communities to the family. They can then view the information that we send to them. They can also view them online to see kind of, hey, what does this community look like? I've never heard of this. And then once the family looks at those, they come back and typically will say, hey, Todd, we're interested in touring these 3 communities. Can you set these times up for Thursday and Friday? We'll set the tours up with the facilities, and we actually go with the families on the tours. And we do this for a variety of reasons, but the main reason is we know the licensures that the communities hold. We know what they can and cannot do for residents, and we're able to be that advocate for the families. If there's anything in question that comes up about the care that's should happen. And so when we move someone in, we have a follow-up process that we usually do. We'll follow up day of move in, we'll follow up a week after move in, and then we'll follow up 30 days after move in. And then from there, we usually go like every 3 months, 6 months, something like that, to just talk with the family and figure out how things are going. And our intel from the families is something that is very difficult to get. You can't get it from the state website. You can't get it from CMS. You just, these other places, it's very difficult to find that information in assisted livings. And so, we identify things that may be of a concern to a future family. And that's really how we get to know the communities, the people there, um, and what might be a good fit for the next family that we're working with.
And you said this is a completely free service to the families that you're working with, right?
That's correct. Yeah. Yeah. So our compensation actually comes from the communities themselves. So, at the end of the day, I mean, we're really like a realtor, except for seniors.
So in kind of wrapping up, kind of based on the experience that you've had with families so far, do you have any advice that you would give to just anyone who has an aging family member, who may be on the verge of being able to live alone? Just, obviously come talk to you, but what advice would you give people who are seeing that situation come up in the future?
And start the conversation early. It's something, in the 3 years that we've been operating, we haven't worked with one family that said, I'm ready to go to assisted living. Everybody wants to remain at home. But again, when their safety is at risk, it's not. We've had a lot of situations that have occurred that someone maybe didn't move to assisted living, and there were some catastrophic things that have happened. But if you can start that conversation early, to give a little more time for things to kind of set in with that particular individual, there's a greater likelihood of getting them to agree and happily go to an assisted living community. And two, it's kind of like shopping for a car at some point, at some level. Not really, I probably shouldn't even use that example, but you can shop for assisted livings and just look around. There's no harm in doing so. And it's better to be prepared than someone who is, maybe in the hospital and now we have to make a decision. We have no choice. The kids work, mom and dad are at home, and we keep ending up back in the hospital. Like, things have to change. And so if someone is in that situation of being at home, we have options at that point. When it becomes crunch time in a crisis situation, maybe not so much. We kind of have to go with wherever we can get to at that point. So it's better to start early and just have those conversations, because at the end of the day, it's their choice to move or not. And part of our goal as well is to educate and inform the families on what their options are. And if we can do that, most of the time the families and the patients themselves, they feel better about that transition and that move being right for them.
Yeah.
Not that, Jennifer's trying to stick me in a nursing home.
Yeah. And I just thought of this, but do you all help at all with any kind of in-home care as kind of a first step, or yours is completely facility based or out of home?
We do help with in-home care. We walk through that with a lot of families. That's kind of usually the first start.
Mm-hmm.
And families oftentimes quickly back off of that because of the costs. When you're looking at in-home being 30, starting at $30 an hour, and most registered agencies wanting a 4-hour minimum, it's hard for families to justify $120 a day, or $6,000 a month for someone to come in that's only coming in 4 hours a day. And some families, out of the gate, we're starting to look at some in-home care and 24/7. And you're talking about 22 to $26,000 a month. A lot of folks just don't have those resources to be able to afford that very long, nor do they really want to. They've the different generations have had to save money and do different things over the years. And when you start talking those kind of numbers, they kind of retract and say, okay, the assisted living now didn't look so bad at 24/7 care. But yes, we can provide in-home care options. And for some individuals that works, a couple hours a week is fine. It just depends on the needs. But we can do that.
And then I'm sure part of this is covered in your meetings with families, but I'm sure you all have learned a lot about insurance and Medicare and Medicaid and all of those things that are involved. But are you all able to help answer those questions about, what is covered by Medicare or Medicaid, and then, or at least have someone in those departments that you can refer them to?
We do. So we get into, we don't get in as much with Medicare, unless someone's in rehab, then excuse me, then we can basically identify, hey, here's how long you're roughly going to be here, given your current insurance policies. So maybe someone has a traditional Medicare with the AARP supplement. That supplemental policy will pick up days 21 through 100, versus someone that just has a Humana or Anthem replacement plan. They're probably only going to get 21 days, if that. And then when you look at Medicaid, so there's a lot of elder attorneys and estate planners out there that do Medicaid planning. And it's really to get folks under asset limits and under income limits to qualify for Medicaid. And that's the interesting thing about Kentucky. Kentucky assisted livings and personal care do not participate in Medicaid. So Medicaid is not a payer source in there. Medicaid only pays for what most people think of as the nursing home, or skilled nursing environments. And so, yes, we do have those conversations with families about, their Medicare policy, their, getting them on Medicaid. We also work through them with long-term care policies that may pay for their assisted living. Work with veterans for aid and attendance. It's a program through the VA to get more money if someone goes into assisted living. And so we're working through all those different funding sources, if you will.
Okay. The majority of what it, going into an assisted living is out-of-pocket expenses for the family member or family.
It is.
For most people.
It is. Yeah. And a lot of times that expense for assisted living, many cases, it exceeds someone's income. So you're kind of, a lot of our seniors are on the flip side of where everyone is normally in life. You don't want to exceed your income. Mm-hmm. But when you get to that age, a lot of times the income does not match up with what the costs are going to be. And so it's, how do we bridge that gap? Well, do we use equity from the home? Do we, there's things like reverse mortgages, which we don't do a lot of, but then the VA with the aid and attendance, do we have someone that was a veteran, maybe the spouse of a veteran, or long-term care policies, or, hey, Todd, we have, $4,000 a month in income, cost is going to be $1,000, but we have $100,000 in savings. How long is our money going to last? And, where can we go with that money? And again, that's all part of our care discovery process that we do with the families to make sure that, hey, we're moving somewhere where we can have some longevity. So we can afford to stay here for 5 years, and as long as mom or dad are doing well, they can stay there. Or maybe they want to age in place. There's communities that allow different transitions of levels of care. Again, we look at the financial situation with that and say, can we do this? If not, when are we going to have to go to Medicaid? And kind of the same thing with the, trusts, utilizing revocable and irrevocable trusts to help pay for care. So a lot of individuals will utilize trusts in the event that they have to go to the nursing home. There's ways of utilizing those resources to help pay for assisted living if someone doesn't meet the qualifications to be in a skilled nursing environment.
Well, it sounds like
Are you confused yet?
sounds like there is a lot, that, we could probably do a whole other ask the expert about, just like at our age, like planning for this, like, how do we kind of take the burden off of our kids
Right.
in 30 years to put us up somewhere nice, so, that might be something for the future, just kind of some future planning. So it sounds like there's a lot to it, and you all do a great job, and thank you for joining me today. I think we have a few minutes left, but did we hit on most of the things, or is there anything else that you want to touch point on?
No, I think we hit on a lot of things that we do. And again, it's just making that phone call. We're online, carepatrol.com. And just connect with one of us. We've got 2 other senior care consultants who work with us, and it's just us engaging with the families as early as possible, and in hopes that we can help plan. We can be part of that planning process, because the reality is, you really can't plan for this. You don't know if you're going to end up in assisted living. You don't know if you're going to need skilled. Like, you don't really know what level of care you're going to need. But having the education and information about what those different levels of care entail, and some rough price points, families are much more confident when they're educated about what's going to happen or what could happen. And that's really what we want to do.
Yeah. And sitting down when everybody is healthy and in a good place to discuss it, I imagine is a lot less stressful than that
Right.
decision of, we're at the hospital and the doctor says she can't go home.
Right. I
I
go
but
back
you
to
can't go home.
yeah. I go back to the car buying thing, because is someone who has an accident and needs a car, they don't have much leverage. I mean, they need to get a car. Someone who has a car but maybe thinks, I'm just going to upgrade, get a new car. Okay. They have time to think about
And
that.
options, yeah.
Right. In senior living, unfortunately, is kind of the same way. You may not need it today, but you should, everyone's going to need help at some point in their life. And with the baby boomers coming up, I mean, we're seeing a lot of folks starting to get into those situations, and just, the kids really don't know what to do, because why would you? You never have to think about moving someone to assisted living until the time happens, and then everyone's scrambling.
Yeah. All right. Well, thank you so much for being on with us today and talking about Care Patrol and all of the great things that you all do to help families who are in these situations. And just thank you for jumping on with us today and talking about it all. And we'll wrap it up. And this has been our September 2023 Ask the Expert interview with Todd Lamkin, owner of Care Patrol in Kentuckiana. So thank you, Todd, and
Thank
hope
you,
everyone
Jennifer.
has a good day.
Bye-bye.